goals of the wellness program are to help people to modify those lifestyle risks that can potentially lead to poor health in the future. Members are selected for the wellness program by taking a health assessment, and depending on the results of that health assessment, they may be picked to work with a health coach. I think our job provides value to members by really helping them and supporting them in making those lifestyle changes. And in doing that, we also can provide a lot of information to members that they may not have to make them successful, as well as offering them access to other benefits and programs they have that they might not realize are available to them. I want members to feel empowered. I want them to feel good about their plan, and I want them to feel like they are going to be successful with what they now have decided to do for themselves. When I'm talking to a member that's working on lifestyle changes, what I really do is listen to what they would like to accomplish. And I help them to identify for themselves what are the advantages to all these changes that they are planning to make, and then work with them to really come up with a plan that will work for them and help them to be successful. For example, I had a member I was working with whose focus was to quit smoking. And talking through a plan for this member, we found that his biggest barrier was going to be for him, what was he going to do with his hands and how was he going to manage his break time at work? So we came up with some ways for him to keep his hands busy. He decided to carry a pencil in his pocket and to do something different at work during his break. So he was going to do crossword puzzles. And then on our next call, I learned he did get the information he needed and he had successfully stopped smoking at that point. I think members sometimes feel that when they do a coaching call that they are going to get a coach that is going to make them or tell them what it is they need to do and how they're going to do it. And that is not the case at all. We're here to help support the member with the changes they want to make. When members are hesitant to work with me, I find out what their concerns are. And a lot of folks will tell me that they are very concerned that their personal information may get back to their employer, or that the information they share with me may somehow impact their insurance or their ability to get insurance. And I reassure our members that the information they share with us is private, it is confidential. Anybody that's starting to make a change to improve health, it's not easy. So I really encourage people to pick and focus on one change at a time and get very comfortable with that change and give themselves time to make it part of their lifestyle and then add the next step so they're not completely overwhelmed and they wind up being successful.